Hi, I'm Dominique Guerrot from Rouen in France. I'm a member of the social media team of the ERA-EDTA. I'm very happy to present Dr. Marco Trevisan from Karolinska Institute in Sweden, in Stockholm. So he's going to talk about his very interesting study on the benefits and risk of stopping MRA treatments in CKD patients. Hi, Marco.
Hi, thank you for having me. Okay, so the study that we did together with other collaborators was to evaluate the stopping of mineralocorticoid receptor antagonists after an hyperkalemia event and the risk of the adverse outcome in patients with heart failure. So the main aim of the study was to compare the risk of these adverse outcomes in heart failure patients were initiated on mineralocorticoid receptor antagonists, and we compare between continuing or stopping the treatment after the first episode of hyperkalemia. So the exposure that we defined was to the continuing or stopping MRAs in the 4 months after hyperkalemia, and we focus on 3 main outcomes. Major cardiovascular event, defined as a composite of non-fatal stroke, heart failure, myocardial infarction, and cardiovascular death. A subsequent moderate or severe hyperkalemia, defined as a plasma potassium of more than 5.5 millimole per liter, and all-cause mortality. In our study, we use methods that aim to emulate a randomized control trial using cloning, censoring, and inverse probability of weights. And we use this weight to obtain hazard ratios from a Cox model and to obtain Kaplan-Meier curves. So in a study population on 1,623 individuals, we identified almost 1,000 major cardiovascular events, and we observed that there was a slightly protective effect of continuing the treatment after hyperkalemia comparing to stopping the treatment. And these results were actually consistent among subgroups, in particular age category, eGFR category, defined as more or less than 60, sex, and severity of the hyperkalemia event. And then we also observed that there were almost 450 subsequent moderate and severe hyperkalemia events, where there was a 20% higher risk of having another hyperkalemic event after continuing the treatment compared to stopping the treatment. And these results, again, were consistent across subgroups that we consider, and also among patients with different CKD stages. And then I will have the conclusion. So the continuation of the treatment with MRA after an episode of hyperkalemia was associated with the protective effect in terms of cardiovascular events, but also could increase the risk of having another hyperkalemic event. These results were consistent among age strata, eGFR categories, sex, and severity of the initial hyperkalemic event. And as a sort of take-home message, the decision of whether continuing or stopping the treatment should be carefully taken and should account for this sort of like trade-off balance between possible cardiovascular benefit and risk of subsequent hyperkalemia. Thank you very much.
Great. Thank you very much, Marco, for this very interesting study on an important problem for us nephrologists. So we're happy to see new data from you and your team in the following weeks and years, I hope. Thank you very much for your help. Bye.
Thank you very much. Bye.